I can't stress enough, really, from a healthcare perspective, how important, that term flattening the curve is,
Yes.
right?
So let's talk about that.
yeah.
Just for, I'm hyper aware of it. I have two children with some heightened exposure risks, and so my wife and I's ears have been to the ground. But by flattening the curve, I think most people are familiar with that term. But can you just tee it up from your perspective, professional perspective, why that's so important, what it means, and why it's so important?
Right. And, I think a lot of folks probably a month ago had never really heard that term. Now it's as ubiquitous as go blue, right?
Right.
And it's interesting because really that term flatten the curve was coined by a U of M professor, Howard Martell. And it really, he was studying the 1918, that big flu epidemic that
Yeah.
really affected this country, and really looking at cities that really did well through it and other cities that did not. And what really became clear is just the significant importance of social distancing.
Yeah.
To really curtail that big spike in cases. Mm-hmm. And the reason that big spike is so concerning is that as a country, we have a very defined set of hospital beds, hospital providers.
Yeah.
For a country of 300 plus million, depending on what you read, we've got about 800 to 900,000 hospital beds. So if there is that big spike, it's going to overwhelm the healthcare system. Whereas if you flatten that curve,
Mm-hmm.
We can stay within our capacity.
Right. And just to plus on to that, from my understanding, and you can correct me at any point in this conversation, but the idea is not to, we may still get infected, but if we don't get all infected in these huge waves that crush everything, that's really the danger. As you spoke to Italy, maybe you can relate to how the curve was much steeper there and what you've learned from Italy and how that applies to all our efforts to flatten the curve here and limit our social interactions.
Yeah, a little bit of a personal hit for me. I did some of my training actually in Ancona, Italy, and so I'm very aware of how modern that healthcare system is. I mean, it's an amazing healthcare system.
Yeah.
And really to see them overwhelmed by really that curve, that spike, to see their ICU beds just completely filled, to see providers, dying, actually, physicians and APPs and nurses. So that's really informed us. I think that really sounded the alarm bells for us in this country. So this social mitigation has been key to really flatten that curve. I think we're going to really see in the next 10 to 14 days how successful we've been. Hopefully we've been very successful.
This Full Exposure Podcast episode has been made possible through the support of Metro Health, University of Michigan Health, and Dr. Peter Hahn, who believe that creativity and the arts are essential to a rich, healthy, and fulfilling life.